Hello, everyone, and welcome to Vita News Live. I am your host, Dom Garrett, and I am so gracious that you all took time out of your day to join us here on our program. It is Thursday, and we are about to start our second panel discussion in our series entitled Why Bans Are Not Best in LMICs. As you may know, there was a Bloomberg-funded tobacco control organization called the Union. They released a position paper about a month and a half ago that was entitled Where Bans Are Best, basically saying that because of the resources and the funding and multitude of factors inside of LMICs, or low and middle income countries, the Union made it their position that they recommend that all safer nicotine products are banned completely. We at Vita News believe that this is a incredible mistake. There are scientists and experts, public health experts and policymakers that agree with us as well. However, because of the pressure from these organizations and organizations like the World Health Organization, this is something that is unfortunately pushed, and many health authorities inside of these low and middle income countries are taking these recommendations very seriously. So what we wanted to do is to host a series of panel discussions, not by those that are speaking from these high income countries and just telling other countries what they should do, but instead we wanted to bring in guests. We wanted to bring in experts. We wanted to bring in advocates and consumers that are on the ground in the specific regions that the Union suggests that these bans are put in place. We wanted to be able to speak to people that see the consequences, both intended and unintended, of these bans. We started this series last week with a panel discussion on India. If you haven't watched that, I highly recommend that you go ahead, just go back after this broadcast, of course, but you can go back and check out that video. We had 3 amazing panelists, and today we are shifting our focus to Latin America. We have 3 panelists who I will introduce here in just a moment, but I want to say that this is just the tip of the iceberg for Latin America. Obviously, trying to shove a bunch of countries all in together to talk about them all at once in just one half-an-hour broadcast, well, that's pretty reductive, and they definitely deserve a lot better than that. So what we will do is we're actually going to break this into 2 discussions, and I'm very excited because in part 1 here, we actually have 3 panelists, all from South America, who are very well-known activists. They are all incredibly humble, and I'm sure that they will say that very soon, but I am very excited to be able to introduce them right now. And I am so glad to be able to bring in our 3 panelists. I will go ahead and introduce them right now and then give them a chance to talk to you. First off is Ignacio Levia. He is the founder of Aso Vape Argentina. You may also recognize him from our spotlight piece on Colombia that we put out a few months ago. We also have Alexandre Lucian, who is a journalist for Vapor Aqui in Brazil. And then we also have Francisco Ordóñez, who is the founder of Aso Vape in general throughout the entire Latin America, as well as the founder of ARDT Ibero-America, which was the subject of that Colombia spotlight piece that we put out. Gentlemen, thank you so much for joining me on the broadcast today.
Thank you,
Hello, Dom. Glad to be here. Just a little thing, I'm from Chile, not from Argentina.
Chile. I'm so sorry. Why did I say Argentina? That is
Don't
my
worry,
fault. I should know that by now.
Latin Americans, and we are working and trying to help as much as we can our brothers from Argentina that are having very big troubles too. So there is no harm.
No, yes, no harm. We are here to reduce harm, not create it. So I'm sorry for that, but we definitely know from our time in Colombia, you know, where the pisco is obviously the best. So we at least know that. So we've got that under control. But I do want to just take some time here, and I'll go through one by one to give each of you a chance to introduce yourselves. And then also at the same time, if you could just very quickly sort of give our audience an overview of sort of how you got involved in the tobacco harm reduction space in general. And Alessandro, I would love to be able to start with you.
Okay, thank you very much for the invitation. Hello, guys. Hello, everyone who is watching us. My name is Alexandre Lucian. I am just a former smoker who smoked 3 packs a day every day and try everything to quit smoking. I tried patches, gums, remedies, my cold turkey, my sheer free and will of trying to quit smoking, but I never had I think the strength in me to really quit smoking until I found out about e-cigarettes. And then in 2015, I quitted 3 packs a day in 30th of May of 2015. And because of that, I was so amazed by that device that saved my life. I started to get in touch with people and start to participate in Facebook groups and WhatsApp groups to help people to understand about e-cigarettes. And since then, I became an expert on e-cigarettes. I became a journalist because of that. I started a blog called vaporaqui.net, which I can bring information to people in Portuguese language. I started a YouTube channel. I was very connected to people trying to quit smoking but not being able to with all the classic methods. And then today I can say that I am very inside the community and with participating in some events on our governments about regulation of e-cigarettes, because in Brazil we have a partial ban. We don't have the ability to have a commerce of e-cigarettes, but we can have one, we can use one. So we have a very big black market, and we are trying to share information about e-cigarettes, about vaping, to try to help people quit smoking, those who cannot quit smoking with the classic methods. And that's why I'm here. I'm trying to help people understand what is vaping and try to fight the fake news and the misinformation, the media, the mainstream media, and all the group interests in not saying exactly the truth about it.
Exactly. Well, thank you so much for joining us. I really appreciate you being here. Francisco, I would love if you could go next. Please tell us about how you got involved in this journey.
Okay, thank you, Dan, for the invitation. Hi, guys. My name is Francisco Ordóñez. I am from Colombia. My journey in harm reduction began almost 7 years ago, looking for alternatives to quitting tobacco. I sorted to patch, gum, inhalers without obtaining good results. And my search, I came across the electronic cigarette. The first day I received the first electronic cigarette. From the next day, I started smoking. I got involved in Facebook groups of users of the device, and the first attempt of the revolution arose in Colombia, which moved in these groups. With some users and owners of the first vaping shops, we decided to organize a Soviet Colombia. After the association we created, we had contact with an staff of Spain, which is our sister association from who we have learned a lot. These were my James reduction journey begins advocating the use of the device. After a while, we contacted another association that had emerged after a survey, more specifically with Pro Vapeo Mexico and with the Association of the Costa Rica, to which Spain joined, and we created the first alliance for the associations. It was internal alliance and support between us. A survey has been a point of reference for their countries, and which have provided. Thanks to this support, more than 14 associations have been created today in Latin America, and RDAT Iberoamerica has been created, which brings together all the associations in defense of the use of nicotine administration device as an alternative for reducing harm caused by smoking.
Wonderful. Yes, it was really a treat for us to be able to be there in February, to be able to see the signing of the charter for that alliance. it seems like many, many years ago because of everything that has happened in the world since then. But I am very glad that we were able to be there for that. And I will certainly ask you some more questions about the Alliance and how that has worked, in the last 6 months or so. But I wanted to get to Ignacio. Ignacio, thank you so much for joining. I know some of our audience is already aware of your story, but if you could just give us a little bit of how you got into tobacco harm reduction, your journey, and the battles and the fights that you have been a part of thus far.
Well, first of all, Don, thanks for the invitation, but also thank you for all the work you have done trying to fight for vaping and other kind of ways to reduce the harm of tobacconist. Vida News is a very, very important and so professional way to show the people the reality of vaping. So first, I want to thank you for your work and the work of the team, that it's absolutely awesome. I don't like the words like expert or that kind of thing. I just feel like another vapor user. Maybe with a little more experience. I was in the very early times of the e-cigarettes. I started vaping on 2009. That's a lot of years now. I'm getting old. I used to take 2 packs of cigarettes daily. Many of the histories are like mine. I tried most of the possibilities that we had to stop smoking, to quit smoking. I got from hypnosis, stitches, I don't know, Chantix and all that stuff that many times doesn't work on smokers. And in a lucky thing, at that moment there was not much e-cigarettes in the market. I was lucky, and I stepped in front of a e-cigarette, and I said this could work. I quit smoking in 2 days. I never light up a cigarette again, and I was very happy about that. But in the middle of 2010, the Minister of Health of Chile started pointing out that he will try to ban the e-cigarettes in our country. It was the same time. In that moment, it's difficult to understand it now, but we see the problem as local problems.
Yeah.
We were not that connected like today. And it was in the same period where the government of Brazil, Argentina, Uruguay go through the bannings and forbid the e-cigarettes in those countries. Gladly, in that moment, I got connected with one of the owners who held the most important part of the industry, and we create a campaign telling that what the minister was saying was absolutely a lie. And we fight very hard for it, and we were able to stop at least the ban, but we have anyway a very bad move from the minister in that moment. So in Chile, the only one that can sell nicotine now are the pharmaceuticals. And we all know, and let's go straight on that, if there is someone that don't want the vaping to go through, are the big pharma industry that wins a lot of money, not only from cancer, from many other problems that cause the normal cigarette. And in that moment, it was like a moral stuff to start fighting and go through.
Yes.
Later, during 2011, my sister got cancer, not related to cigarettes. I want to be very clear on that, because maybe someone could think that I'm trying to make use of it. But cancer is cancer. It doesn't matter it came from smoking or from other reasons. And cancer affects very bad the families. I see my parents to get old very fast during that heart cancer that my sister had in that moment. They were like more than 1 year fighting against it, very close to be dead. Just to understand how bad it was, on the latest time, my sister lost a kidney because of the cancer. She
Wow.
had been on surgery. I can't count them, but more than 30 times until now because of the cancer. And many years later, she's still having some surgeries to go through some stuff that it's still making problem for her.
Yeah, there are
But
lingering
gladly
effects
she
with cancer for
didn't.
sure.
Yeah, gladly she didn't die. She's still alive, having a very good life now. But a year later, from this moment, that it was only 1 week after that we knew that my sister was um, not fully healed, but she was going over the cancer. They detect cancer on me, and maybe that was the worst moment in my life. Not because of having cancer. I have said this many, many times. At least for me, and I know from my sister and other people that have cancer,
Yeah.
it's a way long more easier to have cancer than to feel that someone in your family is having cancer. But to tell
Yes.
my mom, now it's starting again with me, was a very difficult moment. And that's something that people don't understand. Fighting for reducing the harm of cigarettes or tobaccism, it's not only for the people that it's dying, it's for their family, for their friends who suffer, and it's a way of evil, criminal, I must say, to fight against those possibilities that can make people live longer,
Yes.
have a better life. It's like,
Yeah. And
and
I
that's
wanted to
take me
say,
to.
Ignacio, I really appreciate you specifically because, we talk about it all the time, and you just raised the point, but, we think about these numbers, right? The idea of 1 billion people in the century that would die from tobacco-related, illnesses. That number is large, but if you think of the network effect, right? How many people it actually hits, how many people it touches, the grandchildren, the aunts, the uncles, the moms, the dads. The fight that we're fighting for here, and especially in low and middle income countries, especially where, a lot of people are watching this from the United States, where, families are not necessarily as culturally close as they are in places like Latin America. Having that long reach of these diseases is incredibly painful. And so I guess the question I wanted to ask to you, Ignacio, what is it that you think friends and family members of those that smoke, that are getting this misinformation, that are hearing these things, what do you think, what is the message that you want to share to them, those that are connected to somebody who is smoking that wants to try to find a way to quit through these products?
Well, the first thing is to understand that there is people that want you to don't know the truth about e-cigarettes, and to understand how evil could be the people, but understand why. Just in the case of the cancer of my sister, during the first year of treatment, the cost of the illness was like $250,000. Only one person can produce that amount of money to the medical and pharmaceutical industry, and they really don't care about our health. The first thing is to understand that if you really do care about the health of your family or your friends,
Yeah.
you should get more involved to read about it. Don't take the first information as true, because each time you tell to your friends or to your family members, oh, don't use vaping, in the TV they said that they are even worse than the cigarette, you are condemned them to go back to smoking. And today, there is no way to say that smoking it will not end on the death of the people that you love. Try to read more, try to get more involved, give them the support needed. Quitting smoking, it's not easy. That's the good thing of the e-cigarettes. They are not only a good way to go out, they are an easy way for a smoker. It's something that is fun. They can get even involved in a new hobby. And the most important thing is always remember that vaping saves lives. That's the most important thing. And if you want to save your people, you need to support them in this.
Yes.
And the most important thing,
Yeah.
another thing important to remember to those people, is that it's 100% proved by the science of the world in many, many, many studies that there is no passive vaping user. There is no way that someone, when smoke in the house or close to their friends or people that they love, they are making harm on them.
Yeah.
In this case, with vaping, that disappeared. So it's just that should be enough to understand how good it's to change for vaping.
Exactly. Yeah, we had Dr. Roberto Sussman on the program a few weeks ago, where he was discussing the actual scientific studies of how quickly that vapor actually does break down. Alessandro, I wanted to ask you as well. Ignacio was talking about this battle against misinformation, and you were saying that is one thing. Obviously in Brazil, like you said, there is a partial ban, but there is obviously a lot of misinformation that has happened to get to that point that keeps those bans in place. You do work as a journalist writing about this. Can you share a little bit about some of the misinformation that has been spread in Brazil and what you have done to fight back against that?
Well, you have to understand that the general population will watch the open TV and will watch the morning shows that will show some very easy information to digest. You have scientific studies that are fun to watch, but not exactly true or even uses good methodology. So the probability of someone of your family or co-workers or friends to absorb this type of information that says things like e-cigarettes are more harmful than smoking. The problem like the United States had last year with EVALI, which was a disease, more like epidemic problem with cartridge of THC counterfeited with criminal organizations behind it that sold these fake cartridges contaminated with vitamin E.
Exactly.
So it was a problem never linked to vaping, but with the misinformation shared among the mainstream media, you have things like saying that e-cigarettes killed so much Americans, 50 Americans, and then more than 100 Americans, 2,000 people were hospitalized because of electronic cigarettes. They say vaporizers without making sure to people to understand that they have nothing to do with nicotine vaping, nicotine use of e-cigarettes. So those kinds of information are very good to share because you have the attention of the public, and then you have coworkers and family saying things that they don't understand exactly. And then when people try to share good information, proper information, truth information, they are people like me. I have a YouTube channel, a website, but we are very little in comparison to big network stations that are consumed by millions of people. So when you see on TV some physician, a medic, a doctor using the coat, the white coat, and saying things that are clearly wrong, but he is on TV, it must be true. And then you see some guy like me that was not a journalist, that became a journalist because my work with vaping. And I have a YouTube channel that is not a couple thousand people watching. And then you compare the two of them, who you're going to believe? The guy that's on TV or me that I'm here on YouTube telling those things?
Yes.
You can say to people, so go to Google, find out about those studies on England, on UK, New Zealand, even America. But people are not going to find out and take their time to go look for that information. They want everything easy to them. And
Yes.
the easier information is on television. And the mainstream media, unfortunately, I don't know if by incompetence, because the journalist behind that piece of article didn't make the proper research about it, or they have a personal agenda that they want to say those things, because sometimes the things are not plain and simple lies. They say right things in a manner that they don't put the truth, the entire truth. So if they say things like vaporizers killed Americans, that's not entirely a lie, because a THC pen is a vaporizer. They just, I don't know, but they coincidentally forget to say that it was never linked to vaping with nicotine.
Yeah.
So when you read only the headlines, you have a completely different truth of what actually happened. And we
Yes.
are in Brazil, Instagrammers, YouTubers, content generators of all kinds try to give the proper information, especially when we say e-cigarettes are not 100% safe, they are not healthy, they are less harmful.
Yes.
The 95 to 99% less harmful, but they are not a toy. They don't. They cannot be used lightly. Kids don't have any business to use them.
Yes.
But if you smoke, it's a very good idea to change it to go to e-cigarettes. If you don't smoke, you are going to receive more harm in your life using e-cigarettes. It's not healthy. It's much less harmful.
Yes.
But the organizations in Brazil, they don't say things like that. They put e-cigarettes the same way as conventional cigarettes, or even worse, because of their personal agenda. I don't know. I think that the only people defending e-cigarettes are us, the consumers, the users of e-cigarettes, that want to have the sales of e-cigarettes properly regulated.
Exactly.
We have regulation, it's banned, but we want a proper regulation. And we can go on and on.
Yeah, and that point there too about the proper regulation, that's one of the reasons that we want to be able to discuss this, is because of the idea that it's such a short-sighted idea that regulation just cannot happen, especially in lower and middle income countries. And that thought, it's frankly offensive. And I wanted to ask you, Francisco, obviously you are doing this work, fighting for this access. You did it in your home in Colombia. You also are doing it across Ibero-America with the Alliance. So I wanted to ask you, what were your first thoughts when you read this position paper from the union? Did you think that there was any points in it that were good? Where do you think that this fell short?
But it's very complicated. This is the usual discourse, a discourse with these arguments that have already been refuted. First, they are aware of the existing scientific evidence that shows the reduction of damage. That is, there is no democratic discussion here in which all the existing evidence is exposed. What is worrying about for the document is proposal to prohibit the sale, which is the first place. It does not know the science evidence it only looks at a small part, and before they don't know the reduction of risks. Secondly, he resorts to moralistic speeches which children are used as shields to justify the ban. Is the true and we agree the minors should not have access to this type of the product, but I cannot be denied to the adult smoker. Have an alternative that allows you to reduce the risks, violating the fundamental rights of the free development of the personality. That is why must be regulated, be prohibiting the access of the nicotine administration device to minors and giving adults the possibility of access in way legal these products,
Yes.
controlling the quality and the other commercial aspects. On the other hand, a large part of the smoking population is among the lowest income people and be generating provision or high taxes. What they are doing in perpetuating smoking in the population. They argue their position from the precautionary principle, but the only precaution that will achieve it is the death of millions of people around the world, preventing these people from having lower risk alternatives and improve their quality of life, reduce the possibility of desire caused by tobacco.
Yes, and we discussed that too. Tomas discussed it on our broadcast. We discussed it last week. The idea that essentially what you have here is you are locking out millions. It was estimated by Samrat Chowdhury that there's 800 million people who smoke who live in low and middle income countries, and to deny access to products that we know are far less harmful. As you've mentioned, 95% less harmful. That is you're splitting people into two different classes of citizens, and that is just not fair. Ignacio, I wanted to speak with you about this. If you can sort of give us a little bit of an overview. Obviously, your neighboring country of Argentina, very similar to the situation that happened in Brazil with bans. We have black markets. You fought against that in Chile. Can you just tell us some of the, what are some of the consequences, both like intended and unintended, when you start to enact these bans, or when you, strongly prohibit and put the control of them in, say, the hands of the pharmaceutical companies, or in the hands of doctors to be able to do that? What does that look like very specifically in Latin America?
I would love to go with that, Dom. Sorry a little, because I want to go a little farther in what Francisco was saying.
Please do.
The first thing is to be very clear that the studies, clutch study, we used to call them, that they are using to set that it should be the product banned or over-regulated in other parts of the world, are fake studies. Let's talk the things like what they are. The real truth is that Grant study has absolutely fake, trying to manipulate the numbers. There is no an epidemic on teens in USA. The numbers said opposite, but these kind of authorities, because they are people going for personal interest or interest of the industry, really don't care if it's true or it's not. They have been shown to be fake studies. I want to be so clear on that. The Glant studies, they were using supposedly that the vape could create heart attacks. And when we go to see the data, or when other scientists go to see the data, most of the vaping people that were on that study have the heart attacks years before even knowing the electronic cigarettes. So that's a very important point, to know that these people continue with this supporting something that have nothing to do. And it's very, very, it's made me to feel that they look the people in other ways, like, oh, they are lower countries, so let's ban it. So we are stupid. We are not able to think in the same way that can do it any other in a most wealthy country. We have the same right to fight for our health than anyone else. So I want to be absolutely clear that there is no point. It's absolutely unfair, but it's also absolutely outside of any reality what they try to set, because it's
Yes.
not true what they're telling. And kids are not vaping more than what you can expect, that it's like the normal thing from lower kids. Trying different things is part of being young. We don't want any single kid vaping. That in that we are absolutely clear. But if you see in the places that they have been fighting against vaping, when you see the projects of law, the how do you say, the fines for the people that sells to young people
Yes.
are like yoke. If we are talking about true, let's go for this regulation, but be very, very hard for those industry or people that will even sell this kind of product to the young ones. We are absolutely against that. We want them to be charged, to have very, very high things. We're in the same row, but it's just a lie they are using
Yeah.
to keep the money rolling in the way they want.
And you see that
About what's going
all
on
over the
with
place
banning,
too. That idea of putting up
yeah,
protect the kids, and plenty of studies, like as you were saying, show
yeah,
that more than anything, it's curiosity. It's not some sort of a plot to try to hook generations. Yeah. So please
yeah,
continue.
absolutely. And about the kids, you make me remind the campaign that the OMS, or WHO in English, make during the anti-tobacco day. They were criminals. I had never seen no one using a kid of 8, 9 years with vapor in her mouth. Can you imagine if any of us do something like that? They will get like crazy. Look what they are doing for the kids. I don't know what they have in their mind, but using kids of that age, it's just criminal. It's against any law. Any law. It's
It's true.
amazing how low they can go trying to lie the people. Vaping save life. That need to be absolutely clear for all the people. About banning process, there are very, very bad things. In the first and most obvious is that the people that could stop using cigarettes and stop dying have no easy way to get to the e-cigarettes. But also you create the problems of the black markets, and it's absolutely known that in the countries with lower incomes, the black market, it's dangerous, it's harmless not only for the people that want to vape, it's harmless on the criminality and all the other stuff that comes from the black market. Raised price for the users, they don't know what they are using, they are not safe, they can be vaping any kind of e-liquid that don't have any kind of regulation. So it's absolutely against the health of the people. Try to ban. We need to regulate them, but not to regulate it to forbid them. We need to regulate them to protect those users, to know what they are vaping, and have devices and also liquids that are safe for the people. The case of the Valley in USA, it's not from vaping. I'm not agree with Alexandro in that it's a medium true. No, it's a completely lie. There were people getting product from the black market that were with acetato of vitamin E inside, that was used by the narco traffickers to use less amount of THC on there. That had nothing to do with vaping or nicotine or whatever. We don't even use any kind of oil. We only use liquids that are based on water. So there is no way that it could happen to someone that vapes for having nicotine. It's a completely lie. They take something that have nothing to do with us to say that there is a problem.
And
None a
speaking to that
single
as well.
person in the world has have.
Yeah, and speaking to that as well, I mean, the
Sorry.
first letter of EVALI is E, and in the acronym that stands for e-cigarette, which in its name is misleading because, as you said, I mean, this was caused from, this was caused from vitamin E acetate in black market THC cartridges. And so, I wanted to ask, you, Hazard, because you are, you're there. There is this partial ban. There is a black market that has popped up. I wanted to ask you, thinking forward, what would regulation look like? Like, what exactly does proper regulation look like in Brazil and across the region in general?
Okay, so I have information about European Institute. It's an organization called Consumers Choice Center. They did a survey about all over the world about how many people smoke and how many people could change and migrate to e-cigarettes and how that impact will change the society. So they made the survey on Brazil. We have the last information we have is 2018. It's 16% of smokers. So we have more than 25 million people smoking in Brazil. Those are not the official numbers from our government, because our government only asks people on landlines, and they do the survey annually on obesity and smoking and other health-related information.
Wow.
They only call to landlines. So in today's 2020, we have the number, a very small number of landlines. We have old cell phones. I don't have a landline, so obviously our information are not going to be more related to the truth.
Exactly.
So we think that we have more than 25 million smokers in Brazil. If we had the same regulations as England, as the UK, which are, I think, the best regulation there is in the world right now, we can have a potential of switching from smoking to e-cigarettes of more than 5.5 million people going to the burn tobacco to the vaporizers. So that will be a very big impact on the society and especially on the health of the citizens.
Very much so.
As Brazil banned the sales of e-cigarettes in 2009, a black market obviously arose. We have very good people trying to have some sales in Brazil, selling things, original things, original e-liquids, not selling fake products. But we, on every black market in every part of the world, you have also the people that only want to profit and only want to sell anything they want just to make a buck. So the black market in Brazil doesn't work anymore, because not only we have a lot of stores, online stores, even physical ones that offer products, original products and fake products. You have to be very careful where you buy your products.
Yes.
To not be fooled by those not so good sellers.
So even though there is this
are already
ban,
using it.
even though there is this ban, there are still physical stores that are in the country where
a
people
lot
can,
of stores. Yes, even those smoke shops that sells the tobacco, normal tobacco and magazines and candies. They also have some e-cigarettes, some pods, some mods, some e-liquids especially, and those kind of stores, they're not specialized stores, so they buy from whoever they find out, any suppliers, and they often sell fake stuffs that they don't even realize that are counterfeited. They by ignorance, but even so, it's their fault. And so in Brazil, last year on Anvisa, our regulatory agency, I went to 2 public hearings.
Yes.
And it was proved beyond any doubt that the black market it is not going away, Black market is here to stay. If we don't regulate properly those devices, they will keep selling things that are making more harm than they should because they are fake. They're liquids that we have no idea how they are made. They come from China with, I don't know any of the hygiene and the proper systems regarding the manufacturing of those liquids. So what we are seeing right now is Anvisa opening the debate, or regulatory agency opened the debate. So since 2009, we have this partial ban. Last year, Anvisa opened the debate to see if anything can change. The tobacco industry in Brazil wants to regulate the sales because they have their own devices and their own products they want to sell, of course. But they see a movement that we cannot be idle anymore. So they promised a decision to December last year. They postponed that decision to December this year. And again, I think a little bit about the COVID problem and all the epidemic, they postponed it again to the first trimester of 2021. But just I want to clarify that despite not considering myself scientific researcher, I say that I don't produce content. I share content produced by other people. So what I do is filter everything that is going on the world. I take all the information in England and America, all the research. And what Ignacio was telling is very important. All the scientific data, hard data across all over the world indicates that e-cigarettes does not create an epidemic among youth.
Yes.
In England, you have less than 1% of the worst case scenario that are kids that never smoked and use an e-cigarette frequently, every day.
Yeah.
In America, they say a lot of epidemic among youth.
Yes.
There is no such things. Clive Bates on e-cigarette summit in London made a panel. He presented to everybody about when you pick that 25% of youth is using e-cigarettes in America, you have to break down those numbers in how much youth is using e-cigarettes and never smoked and are using frequently.
Exactly.
Less than 1%.
Such a small amount.
The majority amount, more than 50% of users were former smokers. So let's be pragmatic. Let's not go with ideology. If I have a son and this son is smoking, I don't want him to use anything, of course. But if he is going to smoke in the school, in the street with his friends, I prefer that he use an e-cigarette and stop killing himself, and let's try to put out the first fire. And then we have to have a conversation. But in youth, nicotine, it's very harmful, but it's also more addictive than on an adult. So if a kid is smoking, make him stop smoking. But if you can't, and you probably won't be able to because he is going to smoke behind your back, I prefer that kid vape despite not having a smoke in his lips and killing himself much more than he is vaping.
Yes.
Let's be very pragmatic. Let's not be, let's be
exactly
political correctness. I want that kids don't use anything.
Yes.
But please, come on.
I think we all definitely agree with that sentiment that we do not want we do not want youth that are using these products. We certainly don't want that to be happening. Especially, we do not want them smoking combustible tobacco. But again, I like what you said that we need to focus on putting out that first fire, and that first fire is the death and disease that we know that comes from smoking combustible tobacco that has killed and seriously hurt. We all know people that are watching know this, and I did want to ask you a question, Francisco. Obviously, you have done work on the consumer advocacy side, from what you have done with Aso Vape in Colombia, how you have worked, with Ignacio and others, but then also with the Alliance. And so I wanted to ask you, as somebody who is a consumer of these products, what do you think other advocates or health professionals or doctors, what can they do to take a more active role in the fight for tobacco control, specifically in Latin America?
Dom, everyone must really on the science evidences is the point. If anti-tobacco say there is no enough time to really know to the research things, the project of the evidence shows otherwise. When it's come to harm reduction, this means that is the minimizes harm is not a harmless product, but compared to tobacco is much less harmful. Adult consumers must assert their rights, organize themselves in associations that defend their right to choice, support the associations and proclaim the benefits on switch to the vaping. Health professionals should assume the Hippocratic oath to ensure the health of their patients and truly research existing students and take information position.
Yes, that information, and I like that you bring up the Hippocratic Oath as well. We've tried to do a good job on this program of tying, the idea of harm reduction really ties directly into the right to health that you, I, all of us have that should be guaranteed to us, and unfortunately other things have seemed to have gotten in the way of that. We did have a couple of questions from Facebook. I want to make sure that we're being, that we are being good with everybody's time. Ignacio, I will direct this towards you. There is somebody that was claiming, and perhaps you can respond to this, that using products like this, alternative nicotine products, these vapor technologies, it's no scientific study, but people are saying that this causes you to be brain dead. Obviously, I'm sure you disagree with that. Would you like to respond to that comment?
Well, I'm not sure if I'm the best one to say I'm not brain damaged. Oh, come on. I think that kind of comments, we should just skip them. But the truth is that there is no science that show any kind of damage coming from the electronic cigarettes right now. We know that it's at least 95% less harmful than the tobacco. You need to open your eyes. I mean, the people that are asking these kind of things. This is to help people, to make the people live longer, not to die from very, very bad illness, not being able to breathe or having a very bad cancer. There is nothing that produces more cancer than the tobacco right now. And it's the first reason of death that can be withdrawn from there. I want to say two things that were in the past that I really don't want them to go through like that. Okay. I'm absolutely not agree with what Alexandro said about kids using vaporizers. There is no way. I don't care when they said, let's don't be pragmatic. Let's be pragmatic. There is no way that a kid should have a vaporizer in her hands. For me, that's something that I need to establish very clearly. It's our position over it. We don't want kids vaping. Open that door. It has to open the door to parents go vape shops to buy e-cigarettes to their kids, and we don't want that. We have been accused, the advocacy, to want to get this new generation under the nicotine. We were formal smokers. We don't want no one to get into e-cigarettes if there is no foreground of being a user of tobacco. This is to reduce the harm, not to create new users. And the other thing that maybe I mislead or misunderstood, but want to be very clear, all the market that it's in Brazil or Argentina, it's black market under no regulation. There are no specialized shops. So as Alexandro said, those little shops that sell some kind of e-cigarettes don't give any support to the consumers. The consumers don't know how to use the devices because they are not able to go to a formal shop. It's completely illegal market. There is no way to put it in other point of view. Black market in Brazil, Argentina, and Uruguay are complete. There is no way to say there is kind of a non-black market. It's a market not regulated, not paying taxes, not giving any kind of security for the user.
And that, that is
that's the biggest
point.
problem in Latin America when you ban the.
Yes, exactly. That is the issue. That is at hand, and that specific thing of asking for. It's not asking to just stay out of this. It's not asking to, it's not asking. It's just asking for regulation. It's asking to be fairly taxed. It's asking to be able to provide that protection.
Not to have that reality.
Exactly. And I think that is, I thank you for bringing that point up, because it is an important one to make, that, across the world, whether it be in Latin America, whether it be in Africa, whether it be in India, the regulation of these products, we see it here in the United States, as, state by state is trying to do different things. People that use these products, the friends and family of the people that use these products, they want these to be regulated. They want this to be safe. And so I thank all of you. I think we're going to wrap up this conversation right here, at least this portion of it. What I would like.
Can I just respond to Ignacio, please?
Yes, please.
Just 30 seconds. Ignacio, just to be very clear, I agree with you 100%, okay? But I think that this is a conversation that is not, it's not easy to say, and it's very easy to ignore the reality. You are from Chile, you are in a different reality. I think I can properly say about our reality in Brazil. I know that you understand also the market and the society in Brazil, but I'm here inside the society. And like I say, with all the property that we have to be pragmatic when you say, oh, that a kid doesn't have to be vaping. Of course, a kid never should put their hands on a vaping device. But some kids, a lot of kids are smoking today. Can you make those kids stop smoking tomorrow? Can you make them stop smoking less a week from now, a month from now? Are you going to put them on ground and say that they cannot do that, and after you turn your back, they start smoking again? So I think that when you smoke, you are killing yourself. If you can't stop right now, okay, but if you can't, what difference adult that can't stop smoking from a kid? It's much worse. And then we're going to make a political correctness speech about, oh, never do that with kids. Kids doesn't belong to vaping. Yes, they don't. But if they're going to smoke anyways, what are we going to do with those kids? Telling them to not smoke and turn your back and never tell them about vaping. And another thing, yes, you're right. Everything is illegal in Brazil. But a lot of stores that exist today illegally wants to go legally. They want to pay taxes. They want to hire more people. They want to become a brand. They can't because of the regulation in Brazil. But there are a lot of good people that indeed help consumers to know what to buy. They take their time to answer when they ask about which devices to buy, how much nicotine, which kind of nicotine. there are those people with stores selling and also helping people, and those people are in the same place as the bad ones, those who doesn't care what they're selling. So yes, in Brazil everything is illegal, but there are good people and there are bad people, and they are on the same place. We have to regulate, to proper regulate, to those good people have a chance on the market, and those bad people goes away.
Yeah, you know what I think that this does more than anything is highlight how complex and complicated this topic is. I think what it does is it shows us as well what we just saw right here. Some people, and especially people in other parts of the world, may look and see Chile, they may see Brazil, they may see Colombia, they may assume incorrectly that there is a lot of, that everything is the same. And I think that, part of the reason why we wanted to be able to have these panels in general is be able to show that complexity, to be able to show that just saying that there should be a blanket ban across all low and middle income countries is incredibly reductive, and it does not actually serve anybody. Except for those coming from an ideological place that want to just maybe try to feel better at night thinking that they did something for other people, which, as we know, does not actually help and causes harm instead of reduces it. So I do want to say right now, thank you so much to the panelists. Thank you for coming on. I know that the guests and our audience will have more questions. I will make sure to pass those along. You can find all of them on social media, the different places. We will make sure to have that as a link in the description as well. So thank you so much for joining us today, gentlemen.
Thank you, Dom.
Thank you, Dominic.
Okay, that is our broadcast for the day. As I was saying, the conversation may stop with these three right now on our broadcast, but it certainly does not mean that it is over. Please make sure to leave all of your comments, your questions. You can leave them right in the comment section. You can send them to hello@vita.news. We will make sure to answer as many of them as we can to point them in the right directions. But again, this is just the beginning of this discussion. This is something that we will be having continuously in the next couple of weeks. We will be touching more on Latin America, speaking to some physicians, harm reduction experts, and advocates from Mexico and other parts of Central America as well as following up with content, as we said, from Africa, from Southeast Asia, a couple more pieces from India. We have a lot planned, and we are so glad that you have taken part in this with us, and we look forward to seeing you again very, very soon. Thank you so much.